Sure, happy.
Associate Hospital Epidemiologist of the University of Rochester Medical Center. Are prepared to care for any potential patients with COVID-19 or who need to be evaluated for that infection. And we are prepared to do so in a manner that keeps not only our patients safe, but as well as our staff and any visitors to the medical center.
And then if you guys want to just go ahead and start asking some questions.
Talk to me about that. In what way is this any different than preparing for any other highly infectious disease coming to your hospital? Potentially coming to your hospital?
Yeah, I'm glad you brought up that point. We've actually had long-standing general plans and teams in place to care for patients that could present with a new infectious disease or what we consider a special pathogen or highly pathogenic or highly infectious disease. And each of them are unique, but in particular, we've had plans in place for other respiratory viral infections, which COVID-19 is a respiratory viral illness. So that would include in 2009 when we had a new influenza strain, also when SARS and MERS were also in other parts of the world.
Are there any unique challenges to,
learning as we have more cases around the world. So I think this CDC learns.
How quickly one
certainly as a CDC update our clinical staff and administrative staff and
confirmed case in Manhattan.
that it very well may come to Rochester, and no one can say when or definitively if, but we want to be prepared as a medical center to be able to care for that patient safely for everyone.
When you say you're prepared, what are some of the changes that you guys have already implemented or regarding this?
Yeah, a big change is reactivating and meeting regularly with the team that we've had identified and in place for other infectious pathogens like this. So we meet routinely, and we've adopted our general policy to include any guidance that the CDC or our state health department has for this infection in particular. And as I alluded to, we also update based on where we know this infection is and making sure that we pay special attention to anyone who may have had travel to areas that have more cases.
So what would it look like if someone came in and was being treated? What would that look like?
Yeah, the first thing we want to do is make sure that we're using all of the recommended precautionary measures to keep both that patient safe while we're treating them, just as we would treat them for other respiratory infections, but also making sure that our staff and our other patients and visitors here are safe. And again, that's using the recommended precautions
Well, what is that like? Can you elaborate on what
Yeah,
that means?
yeah.
Recommended precautions?
Yep, so it's precautions that we use in various combinations to treat patients with other infections. So making sure that the patient is in their own room, and making sure that if the patient is anywhere, that if they can, they have a mask on to prevent if they happen to cough or sneeze, that our people taking care of the patient also are wearing masks and gloves and protective equipment to make sure that if they need to come in contact with any respiratory secretions from the patients, that they're protected from that.
To piggyback on that, is there more heightened concern among hospital staff? Because yesterday's case that the governor announced was a healthcare worker. Is there more concern among the staff here at U of R that this is something that they could potentially contract?
I'll say I think anytime there's something new, it's understandable that people are concerned as we're still learning about it. But I think they do understand that we have the appropriate protections and precautions in place.
I think with all the media attention this year or recently about this particular virus and the disease has heightened everyone's awareness. So we have had a number of employees ask questions about how we're preparing. So it's been a good opportunity to reach out to employees, to remind them of how we take care of patients that have infectious diseases. They use the same precautions for this type of patient as they would, as Dr. Tassini said. And just to make sure we keep them informed of all the planning that we're doing. So that's been an important part of our preparation as well.
What are you wanting people at home to take away from this when they're watching?
I think the same advice that Dr. Mike Mendoza and all of the professionals kind of both locally and statewide have been saying, and that is be vigilant in terms of the potential for getting the flu or any other infectious disease during the winter months. So wash your hands frequently. Don't touch your nose and mouth and eyes. If you're sick, stay home. Try to avoid being around individuals in close quarters that are sick. If you're a care provider, use personal protective equipment, which we readily have available. And if you do feel sick, make sure when you go to the doctors, wear a mask and discuss those symptoms with your provider.
And to piggyback off that, I guess there's also people are saying, don't just come in, call first and talk to a doctor about your symptoms before getting into an office or an emergency room full of other people.
Yeah, I think it's always great to call first, particularly if you have a fever that you can't really explain or other respiratory symptoms, just to talk it through so they know how to best be prepared and treat you the best way, and also make sure that they're protecting themselves and other patients.
Well, it also doesn't sound like, it's nothing as extreme as, we're going to have to quarantine the whole area and do these lockdowns. It seems like this is going to be a very, there's procedures in place and it's not like a panic or anything like that.
Yeah, I think in our recent experience and what we're learning about the virus as it spreads is it probably is producing an illness that's similar to the flu, perhaps a more severe flu. And so everyone is starting to take the appropriate measures for that.
Generally speaking, in a really measured way. How come you're not worried?
Because again, as we learn about the illness, the vast majority of cases have mild symptoms, so cold-like or mild pneumonia-like symptoms. And so as we learn more about it, we do realize the majority of patients have a relatively mild disease, and we understand how respiratory viruses can be spread from person to person, and so we know how to help protect ourselves against that. And again, just like Ms. Barinella was saying, that using the same measures we'd recommend to help prevent the spread of the flu, we also recommend to help prevent the spread of COVID-19.
What do we know about the chance that the virus is circulating here severe but not producing symptoms that would cause somebody to go to their doctor and be tested for it?
Yeah, that's a really great question. I think as we learn how the virus spreads, we'll start to understand that more. And I think as testing becomes more available, we'll be more aware. But I think with having a case in New York City is the time that we'll start to look more closely in and around New York City. But we're prepared.
Is there a point in between flu and coronavirus where when a patient walks in and has signs and symptoms of what could go either way, what is the determining factor other than the test? Is there a, you know what, this is the flu, or goodness, I think this actually could be coronavirus?
Yeah, I think the test, so we have in most hospitals would have a very readily available test for the flu, and that is obviously a great distinguisher. Based on clinical symptoms alone, it would be hard for a clinician to tell those two apart without any testing. And for the coronavirus particularly, we still are relying on someone being in an area that has other cases, and particularly being in close contact with people whom they know to have the infection. We still have quite a lot of flu in Monroe County right now. We've had over 4,000 cases reported of the flu in Monroe County this season. So that is still much more likely, and we still want to get that message out there that people do still have to protect themselves against the flu.
And as you may know, that testing for coronavirus was only able to be done at the CDC laboratory. Recently, I think in the last couple of days, Wadsworth, which is a New York State laboratory, is now able to do the testing. So, and it still remains, although that may change, that the testing is only done when clinicians and local health department get together and determine testing for coronavirus is important to do. But certainly testing patients for flu A, flu B is something we would do when patients present with flu-like symptoms to see if that is the more likely, usually, illness that persons with those type of symptoms are most likely to have. So that would be the testing we do often and frequently.
So the test can't be done locally?
The test, yeah.
Yeah, at this point in time, it cannot. We, our laboratory is working with the state public health laboratory to develop a test that is safe and reliable to do here. For right now, it would be done in Albany at the state health lab.
You can't do the same test here that happens in Albany.
Yeah, that's what we're working on, and we need to make sure that everything works perfectly with the test to make sure that that's the right thing to do.
And I think appropriately, government agencies, they regulate who can do the testing to make sure it's done accurately. And I think once there's some more information about that testing, we certainly have a very high-level microbiology lab here at the medical center. So if it was ever allowed for testing to be done here, our team would certainly work on that.
What's the procedure then for how you decide or how you send a sample to Albany for testing?
Yeah, and that would be done through our local health departments.
That's not a decision made here?
Together with them, yeah, but they help arrange the actual shipment of the specimen and make sure that the lab's ready to run the test as soon as they receive it.
I'm just trying to understand like what you're looking for here that gives you the trigger to call the health department to say, hey, what do we do?
Yeah, so we're looking for someone who has a flu-like illness but does not have the flu and has a risk or a link to other potential cases.
Yeah, and today, that actually, in addition to the flu-like symptoms, it is travel or exposure in an area that has already evidence of COVID-19.
We're still looking for that. We're not looking for like community transmission at this point. We're not suspecting that those cases develop absent that sort of connection.
Yeah, we're not here in Rochester. The areas that, the few areas in the United States that have seen that were areas that already started with cases, known cases brought in. Again, here in Rochester and Monroe County, flu is here. Flu is common. And we're looking for that certainly first, but this is on everyone's mind and everyone's awareness, and it's a changing landscape.
And I guess my last question would be, I guess, is that why you decided to have just this press conference, just let the community know there's no need to worry and that, we're here and ready if we're to come here?
Yes, I think that's good. Our understanding is that we were called and asked to talk about our preparedness, and so we're happy to do that. So we didn't initiate. Yeah, we did not initiate. Yes, yeah, we didn't feel necessarily a need to do a press release, but certainly when asked about how we're preparing, we're happy to talk about that because we have developed a comprehensive plan to deal with this illness. As Dr. Tassini mentioned, it builds upon the plan that we have for treating other infectious diseases. So we're happy to let the community know that we're prepared, we're ready, and again, we want to remind everyone to think first about protecting themselves against any flu or contagious illness during these winter months.
Can you just go more in depth on that comprehensive plan on, what are some things that are specific to coronavirus that you have added?
Yes, some of the specific things that we want to make sure that all our staff know about is to protect yourself, protect all of what we would call it in medicine, your mucous membrane, so have your eye, nose, and mouth covered, as well as making sure that you're using some covering on your body. We use gloves and gowns just to make sure that if you're in contact with any kind of respiratory material from the patient, that that you can't then get that on any of your respiratory surfaces. So that's the most important thing, is to protect yourself. We also have designated areas of the hospital where patients can be cared for safely.
What are those designated? Can you go into more detail about those designated areas? The quarantine setup?
Well, negative pressure, certainly rooms that have negative pressure, and we have a number of those throughout the hospital because, as we mentioned, we take care of patients with infectious illnesses all the time and are placed in negative pressure rooms, and we have those rooms on every single one of our units.
Exactly, so that's the main.
Yeah, and we also have an area that has several of those negative pressure rooms together that we prepared years ago for another viral outbreak. And so that would probably be an area where we'd start, but we could use the other negative pressure rooms throughout the hospital.
Thank you.
Great.
Thank you so much.
Thanks. Yeah, happy to do it.